directors and organizers of the event, Dr. Rajan Naidu and Joshua Kalina, my colleague, the Provincial Minister of Health of the province of KwaZulu-Natal, Dr. Spoliseni Domo, and my fellow keynote speaker, Dr. Hugh Montgomery, the Director General of Health in South Africa, Precious Matsuso, representatives from various structures that have been named here today, including the World Health Organization and other sister and fraternal organizations involved in this battle that brought us here to Durban. It's an honor and great privilege for me to be invited to be a speaker in this summit that has brought together stakeholders whose interest it is to address the impact of climate change on health. I must indicate from the outset that I regard the environment and health, climate change, as one of the most important determinants of health. Unfortunately, it lies hidden because it does not present in as obvious a way as many people could clearly and obviously see. But it's clear that unless we act and work together, we'll not be able to achieve the wonderful and ambitious goals that we set, simply because climate change tends to reverse every single effort that we've put in place over many past decades. In my own country, South Africa, we've identified 4 broad outcomes without which there will never be health for all within our country. And I believe within the African continent, the same apply. Problem direct, I always ask myself, how many of us here still remember the noble ideals that the World Health Organization set in Alma Ata some 30 years ago? That health is not just the absence of disease or infirmity, but is a state of good physical, mental, and social well-being. That health is a fundamental human right, and attaining the highest standard of health is the most important worldwide social goal, whose realization needs action from other sectors, economic and social, in addition to the social sector. And how many of us remember that there was a slogan then that said health for all by the year 2000? At that time, of course, I remember I was a first-year medical student. I never thought the year 2000 is going to arrive. But it sounded very, very far. And ladies and gentlemen, the bad news is the year 2000 arrived and went, and there's no health for all in this planet in which we live. And there are no prospects yet that will ever be achieved unless there are drastic, very drastic changes. In my country, we became aware that life expectancy is going down. For many people, HIV/AIDS being one of the top ones, but life expectancy is going down in South Africa, as it does in the rest of the continent. We are struggling to attain the 4th and 5th Millennium Development Goals, decreasing maternal and child mortality. And of course, you know we are struggling to contain the scourge of HIV and AIDS and TB. And we are struggling to strengthen our healthcare system. One may wonder what does these things have to do with climate change? But how do we increase the life expectancy of people whose livelihood is interrupted and disrupted by ever-changing climate? many of them will surely not see their 60th birthday. People who become displaced by drought, torrential rains, end up living nomadic lives to expose them to other harmful environments, which do not promote well-being. It is obvious that life expectancy in such people is expected to be shortened. Based on this assessment and assertion, it will be a big struggle for developing countries, especially on the African continent, to increase life expectancies of their populations if we do not add issues of climate change in the equation. Because if we do that, we'll be able to design plans that will address it. It is a known fact that climate change affects women and children more than it does men. In this regard, the World Organization has developed a document that addresses the vulnerability of women and children as a result of climate change. This calls upon us to develop adaptation measures that are specific and targeted towards women and children. In the same document, the WHO assessed the following, and I quote, adaptation efforts should systematically and effectively address gender-specific impacts of climate change in the areas of energy, water, food security, agriculture and fisheries, biodiversity, and ecosystem services, health, industry, human settlement, disaster management, and conflict and security. Women make up a large number of the poor in communities that are highly dependent on local natural resources for their livelihoods and are disproportionately vulnerable and affected by climate change. Women's limited access to resources and decision-making process increase their vulnerability to climate change. Women in rural areas and in developing countries have the major responsibility of household water supply and energy for cooking and heating, as well as for food security, and are negatively affected by drought, uncertain rainfall, and deforestation. Because of their roles, unequal access to resources, and limited mobility, women in many contexts are disproportionately affected by natural disasters such as floods, fires, and mudslides. It is important to identify gender-sensitive strategies for responding to the environmental and humanitarian crisis caused by climate change. I close quotes. I deliberately went at length to read this statement from the World Organization to show the plight in which women and children find themselves. Program director, last week, I was scolded and nearly eaten alive by some men, not all men in this country. I was outlining the role that men plays in the spread of HIV and AIDS. And I was just mentioning simple facts. Some radio waves were clogged with men who were paying for my blood. One of them even suggested that I'm trying to canvass for votes because there are more women in the country than there are men. And I'm voting favor from them. I was taken by surprise. I must tell you, I was shocked. It actually reminded me one thing, which is very central to this conference. The COP17, that the rich, the famous, and the powerful can do a lot to affect our lives negatively, and vigorously and arrogantly deny it, and even refuse to change. That's what I experienced last week. Because I was simply telling men we need to change, this is what we are doing to our women. And there was that avalanche of anger. One of them said, I couldn't believe a minister of health can ever say such an outrageous statement. These things are truth. And unless we accept them, if we live in denial forever and ever and ever, this world of ours will disappear in our midst and in our lifetime. So this message from the World Organization needs to be understood by all and sundry. And each one of us needs to play our role. Where we are committing an error, as individuals, or as a group, or as society, or as a particular gender group, we need to accept it so that we effect change. Once climate change starts destroying houses and crops for the poor, and mostly the rural people, through torrential rains and raging storms, people's lives will be at risk. And these peoples will be exposed to poor food security. And as such, they won't be able to control their diseases. When their houses get destroyed, they will be forced to live in houses with poor ventilation. And as such, possibilities of spreading diseases such as TB and many other diseases, many other communicable diseases are very high. Climate change tends to undermine the health system's ability to deliver health services, and its tenacity will be compromised very seriously. Our efforts of re-engineering primary health care systems will be undermined if we do not pay special attention to the impact of climate change on health. For us, climate change is like an untamed dog, which, if unleashed, can inflict very worse injuries into unsuspecting passers-by. We need to spare no effort in addressing this problem, because together we believe we can achieve more. Program Director, I am aware that there is widespread agreement that current trends in energy use, development, and population growth will lead to continued and more severe climate change. The changing climate will inevitably affect the basic requirements for maintaining basic health, which are clean air and water, sanitary environment, sufficient food and adequate shelter. Many diseases and health problems may be exacerbated by climate change. Each year, approximately 1.2 million people die from causes attributable to outdoor urban air pollution, 2.2 million from diarrhea, largely resulting from lack of access to clean water supply, sanitation, and poor hygiene. 3.5 million die from malnutrition, sometimes even in a world of plenty. Approximately 60,000 people die in weather-related disasters, from heat waves to floods and droughts in developed and developing countries alike. A warmer and more variable climate threatens to lead to higher levels of some air pollutants, increasing transmission of diseases by unclean water, contaminated food, insect vectors and rodents, to compromise agricultural production in some of the least developed countries, and to increase the hazards of extreme weather. Previous World Health Organization estimates indicate that the climate change that has occurred since 1970s is already causing over 140,000 additional deaths each year, primarily among the poorest population in Africa and Asia. These risks are likely to continue to rise. In the long run, the greatest health impacts may not be from acute shocks such as natural disasters or epidemics, but from gradual build-up of pressure on the natural, economic, and social systems that sustain health, which are already under stress in many parts of the world. These gradual stresses include reductions and seasonal changes in the availability of fresh water, regional drops in food production, and rising sea levels. Each of these changes has the potential to force population displacement and increase the risk of civil war. Climate change has therefore been described as the biggest health threat of the 21st century. The importance of health has long been recognized in climate change. The United Nations Framework Convention on Climate Change Treaty aims to avoid adverse effects of climate change, which it defines as changes in the physical environment or biota resulting from climate change which have significant deleterious effects on the composition, resilience, or productivity of natural and managed ecosystems or on the operation of socio-economics or human health and welfare. Surveys from around the world shows that the general public place health threats at or near the top of their list of climate change concerns. And over 90% of the National Adaptation Program of Action for Climate Change developed by the least developed countries identify health as a sector that will suffer adverse impact of climate change. Program director, we saw with the risk of being seen as a person who might be complaining a lot. When the World Organization Africa region met in Cote d'Ivoire this year, I actually asked my fellow ministers in Africa, why is this COP17 being organized? And very little is said about us ministers of health, when we know that we are going to be affected the most anyway. Any effects of climate change, the first area where we are going to detect them is definitely healthcare before any other area of life. But I'm not noting any complaint, I'm just noting. I'm just noting that in all negotiations, even in my own country, we just hear this important. They'll never say, Minister, you in health, this is what is going to happen, or ask you what actually is going to happen. So I want us to put the issue of health firmly on the agenda of this summit. A recent World Health Organization review concludes that less than 30% of national adaptation programs have an adequate health assessment or adaptation plan. And international financial support for health adaptation to climate change is approximately 0.5% of estimated health damage costs. The health core benefits of climate change mitigation are omitted from almost all economic models that aim to guide decision making on greenhouse gas emissions reduction, leading to a bias against more sustainable and greener decisions. The failure to connect to health and climate communities and objectives, therefore, a missed opportunity to make progress on both agendas. This can be remedied by a more positive approach, focusing on health benefits of action, both to mitigate and adapt to climate change. There's strong evidence that health interventions can offer cost-effective protection against many climate-related health hazards, including gradual climate changes. Recent studies have also shown that well-designed greenhouse mitigation measures will bring large health benefits. For example, through reduced air pollution. The Intergovernmental Panel on Climate Change also conclude that in many cases, this will cover much the cost of intervention. In the last 2 years, the health community has become increasingly engaged on this issue, as shown by resolutions of the World Health Assembly and regional bodies such as the WHO Regional Committee for Africa and the African Ministerial Conference on Environment, among others. Human beings are directly exposed to climate change through extreme weather-related patterns. That is drought, rising sea levels, floods, cyclones, hurricanes, and indirectly by food, water, air, infrastructure, agriculture, ecosystems, and livelihoods. This direct and indirect exposure can lead to increased malnutrition and consequent disorders for child growth and development, can lead to increased death, disease, and injury due to heat waves, floods, storms, fires, and droughts. It can lead to increased burden of diarrhea and respiratory diseases, increased frequency of cardiorespiratory diseases due to higher concentration of ground-level ozone, increased infectious disease vectors, water and foodborne diseases, vector and waterborne diseases, and mental, nutritional, infectious, and other health effects. Almost anything about health you can think about can be affected in one way or the other. In the light of the above, the Department of Health has worked very hard through the support of other stakeholders, such as academia, research institutions, governmental departments to finalize the development of a draft national climate change and health adaptation plan for South Africa. This plan will be used for further consultation with many other stakeholders who will assist to firm it up. This plan aims to provide a broad framework for health sector action towards adaptation to climate change. The specific objectives of the plan are to describe the economic, environmental, and health context for the proposals contained in this plan, outline a broad program of activities to be undertaken or spearheaded by the South African health sector, giving specific examples and indicate the relevant or potential partners, timeframes, and financial implications. In addition, the following guiding principles have been identified to guide the development of the implementation plan for the climate change and health adaptation plan in the health sector, including prevention, community participation, intersectoral cooperation and collaboration, synergies between climate change adaptation and other public health initiatives, equity, and evidence-based planning. We are already thinking ahead so that once the plan is finalized, we can hit the ground running. This is how serious we are taking climate change and its impact on health. This is taken so serious because if left unattended to, it stands to undermine the little strides that we are trying to make, however small they might be. Finally, the aim, objectives, and guiding principles of the plan will assist and support immensely in fulfillment and alignment with the overall goals of the Department of Health, so that it is seen as an integral part of the mainstream of health service delivery machinery. Our dream of a long and healthy life for all our people will remain a pipe dream unless we identify all possible obstacles, design a strategy to remove them, and then start our journey to a long and healthy life, knowing fully well that all our plans are in the bag. We'll also make use of contracts that we have developed through this summit to ensure that we broaden our network of partners, because we know that working together will achieve more. Ladies and gentlemen, I would like to ask the World Organization that the dream of Alma Ata must never be allowed to die.